This video is part 7 in our educational series on how to utilize a conservative treatment approach by treating soft tissue restrictions for a client who has degenerative disc disease of the cervical spine. In the video, I cover the following. Why is continued maintenance care not only good, but necessary for the client? How do I use simple analogies to help educate the client on the treatment process and the importance of continuing with care? My rules and guidelines in the continued treatment process, including frequency of treatment and load management. For those of you who don't know me, my name is Dr. Matt Maggio, and I am a non-surgical chronic pain treatment expert, specifically for conditions affecting the neck, upper back, shoulder, and arm. My focus is on finding and fixing nerves that become stuck to muscles with a glue-like substance called adhesion, also known as scar tissue, and then reducing inflammation from chronic pain naturally without the use of medications or injections. This leads to a big increase in flexibility, functioning, and long-lasting pain relief. I'm also the creator of the PEAK method, where we teach overworked massage therapists a new treatment system that allows them to cut their treatment times in half so they can avoid that dreaded burnout and help more people get out of pain. All right, this is the last video in this series. If you haven't had a chance to watch any of the other videos in this series, I'll link it up top here on YouTube if you're watching it on YouTube. If not, it'll be down in the description box below. But this video is going to be on the importance of continued care and setting up ongoing maintenance treatment program. Very important. So why continued maintenance care is not only good, but necessary for the client. One thing that I see, and I did this a lot, and I made this mistake in my career over the years, was always like feeling bad if the client needed more treatment. I learned this. It's like never apologize for the client needing to be treated more. A lot of times people are like, oh, I feel bad. I don't want them to spend money on this. And, it's too expensive and things like that. But people spend so much money on so many dumb things that they don't actually benefit them. If you're giving them quality tissue health and function and mobility and longevity, like it's a great investment and it's something that they truly need. And if you're just trying to like space the visits out to help their budget, you're not really doing them any favors. I want you to really focus on being the provider that tells them what they need to hear instead of what they want to hear. Why does maintenance get a bad rap? I come from originally in the chiropractic world, and there's a lot of things that the chiropractic model does that I just don't agree with. But one thing is like this idea of like continued care going on and on and on. And people think, oh, I just want to be done with treatment. I just want that problem to get fixed, to be done and not have to deal with this anymore. But I always say, hey, you still brush your teeth every day. You still take a shower every day. Like you need to get your tissue cleaned up and continue to get it cleaned up because it's going to continue to accumulate more and more stuff. I said continue a lot there, but continue is a very important word. Next thing is, and I made this mistake, and I see so many providers out there saying this is like, my job is to fix you so I never have to see you again. That is a really bad mindset to be in for you as the provider as well as for the client. I get it. You want to be that. You don't want them to feel like you're pushing them to come in more, or like you're just dragging the treatment out. But if they need it, they need it. Don't apologize if they need more treatment. And then lastly, is just understanding as the provider why continued care is vital. I say this again. It's like brushing your teeth. Like you brush your teeth every day. You don't just stop. You don't just go to the dentist once or like, hey, I'm good. You do things like maintenance care is that as well. And your tissue is so important and the function of your skeletal system and things like that. As people age, they're way worse. They can't move. They're disabled. They can't do things as they go later in life. So the more they do early on, the better they're setting themselves up for the future. And it's your job as the provider to tell them exactly what they need and what they have to do with that process going forward. So how do I use simple analogies to help educate the client on the treatment process and the importance of continuing with care? One thing I learned, and I used to mess this up all the time, is always keep communication simple and easy to understand. I used to do things and like draw like all these muscles and pull up my anatomy app and show everyone and like say all the fancy names of all the muscles. It's like, ugh. Or I'd say like, hypoxia causes like adhesion pathway and blah, 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 and accumulation of all that. And the client, it just went over their head. I keep it really simple. I'm like, hey, you overuse your muscles. They're not getting enough blood and oxygen. There's a bunch of crap that's in there getting stuck. I'm going to unstick the stuff with my hands and an instrument. Keep it simple. I'm big on dental care analogies. Everyone understands dental care analogies. And the way I break down The treatment process, when I say to the client, I always say, I'm always talking about working in chronic pain and injury treatment stuff. I'm not talking about relaxation or recovery. That's fine if you want to do that, but that's not what I teach and that's not what I do. So I always tell the client in the beginning, think of the first round of treatment is like I'm the dentist and I'm going to go in there and drill out the cavity, you know? And what happens when you do that is you really start to change the focus on you're getting paid for the result instead of the time you spend. When I teach people, especially massage therapists, I say this idea. I'm like, imagine if you went to the dentist and they booked out 60 minutes for you to drill the tooth, but they fixed it in 20 minutes. You wouldn't be like, hey, doc, tooth feels way better. Thank you. But hey, we got another 40 minutes. I'm going to need you to get in there and dig around a little more, give me my whole time schedule. I want you to get in this idea of like selling to the result, not your time. And dental care really makes a big difference because I'm like, hey, the first round is like getting in there, drilling the cavity out. Then I'm going to show you things you can do in between. That's like brushing and flossing. If you do the good things in between and brush and floss good, you just got to come in every once in a while and get it clean before it becomes a cavity again. We don't want to deal with that cavity again. We got it out of there. So that's where the maintenance comes in. Then I just explain to them what happens if we don't continue care. I'm like, hey, you got this degeneration in there and it will continue to get worse. So our job is to keep all the tissue out of there to slow down that progression and give it a chance to heal up. Because if we just wait till it gets bad again, we're going to be starting all over again and it might not actually respond this time to conservative treatment. And that's where that whole idea is like the clients will say, yeah, I'll just wait till it gets real bad again. And then I'll call you. And most providers are like, yeah, that's fine. Do whatever you want. Like you're not being the leader. You're not doing them any favors. Cause I say to the client, I'm like, you already had the root canal. Why would you want to do another root canal again? Wouldn't you rather just come in once a month or once every 6 weeks and get this problem cleaned up before it becomes bad again? In all honesty, at the end of my process, when I present them with a maintenance plan, if they decline and they don't want to do it, I say that's totally fine. But I actually have them sign a form and it's called a termination of care. And I let them know, hey, if you go longer than 90 days in between treatment, you're going to be subjugated to having to do a full exam. I'm on a waiting list, so I might not even get you in right away. So it really helps the client make a better decision so they can see this and continue to get the benefits of the treatment and care. Because you did all that work in the front end. Like, why the hell would you want a cavity again or a root canal again? Let's just prevent that. And then you really help them understand it. That's why the dental stuff helps so much because they understand that type of concept. So my rules and guidelines in the continued treatment process, including frequency of treatment and load management. So how do I know when I hit a maintenance point? So for me, my goal really is where we can go about a month in between treatment and then all the tests and measurements that I have, they hold pretty good. They might let up just a little bit, but maybe the client's pain level is not too bad. They've been doing the things we agreed upon on load management and stuff like that, and it's holding up pretty good. That's when I know I'm at about a month in between and I'm ready for maintenance. And then after that, I do follow-up treatments. I never want to go longer than about 6 weeks in between the treatments. That's like the max of where I go. I have some people that come in every 2 weeks. I have some people that come in every 3, every 4. And that just depends a lot on like what they're doing with their job or their activity. If they're going to lay down more adhesion, they're not able to do as much. They can just come in and get cleaned up a little bit more often. I would say it's kind of like someone that can't really brush and floss enough in between dental visits. So they just got to come get a deep cleaning a little more frequent to prevent that cavity from coming back. Throughout that process, I also set up, I put it on my schedule and stuff like that, like just some biweekly check-ins when they're in that longer process, just to see how they're doing, check in with them and stuff like that. It goes a long way and shows the client that you're still invested in their care and you want to see it all the way through. And then for my follow-up visits, when I'm doing a maintenance, I start by checking all the tests that I do, all the ranges and motions, and then I treat the worst one. So in like my cervical protocol, I have 4 tests that I look at. I'll take them through all the tests, and then whatever one's worse, that's the one I'm going to treat on that visit. I'm going to check in with them on any of the corrective exercises that they're doing, making sure that they're doing them right, doing them correctly, using that visit to do that. And then lastly, for the last part of the visit, I'm just going to continue to remind them of the idea of like load management and making sure they're doing smart things to keep this problem from coming back. This is how you just keep them in the loop, in the process, continuing with care, not having this problem get a lot worse. And maintenance visits are actually really easy and fun to treat because you just go in there, treat the worst tests and catch up and see them again in 4 to 6 weeks. They're happy, you're happy. It's better for everybody. So that's why I'm really big on maintenance and continuing with the care. That's all I got in the video. If you got any insights that came about, share them in the comment section below. I try my best to engage with everyone that asks me questions. Next, you could share this with other providers that might help, that are dedicated to doing good work. Maybe they're like just working too hard, on the verge of burnout and just doing way too much. And lastly, you can go download our free training modules where we go through the whole system from neck, shoulder, upper back, arm pain, questions, testing, palpation, treatment, even some mindset stuff. Links for that are wherever you're consuming this video. I appreciate you watching, and I'll see you on the next one. Bye.